Good morning. This is Mark Billier with Billier Insurance, and today we're going to just answer a few Medicare questions that I've received lately on a system called Agent Hub. If you're looking for Medicare information in your local area, go to agenthub.com, put in your zip code, and you'll see all the agents that are in your area. And the nice part about it is you can actually type in questions to Agent Hub, get those questions answered, or just see a whole list of questions that come in regularly that agents like myself, when we see them, we're able to respond to them and give people the answers that they need. So that's one of the ways you can find a local broker if you're looking for somebody to talk to. But let's answer just a few questions this morning and see if we can help some people out. So the first one that I get a lot is, can Medicare pay for my groceries? There are a lot of ads, whether it be on Facebook or other social media platforms, and a lot of phone calls come in and they say, hey, how would you like $900 in free groceries, or whatever amount of money in free groceries? You could have that if you talk to me about your Medicare, or call us and talk to us about your Medicare. Well, that sounds terrific, and I'm the first one to tell you as a broker that if I had a stack of $900 grocery cards, I would be handing them out to all of my clients. So first thing I want you to think about is somebody that I don't know just going to call me and give me $900 in groceries and ask for nothing in return? Probably not. So are they lying? Not technically, but there's gray area in there. So here's what you're seeing. You're probably seeing an ad or getting a phone call that says, hey, would you like free groceries? Medicare can do that. Your Medicare Advantage plan can do that. Well, some do, but typically they're for people who are on Medicaid, full Medicaid, and Medicare both. And that's called a dual plan. So if you have a dual plan, now you're closer to that opportunity. But your plan still has to offer it, and not all plans offer it. So are they out there? Can they help people? Absolutely. Do most people get them? Absolutely not. Are the chance that you're going to get it? Probably not, because if you are already on Medicaid or Medicare and you didn't know that, then whoever you're working with isn't doing a very good job for you if you're eligible for those benefits. And so you need to find a new broker anyway and investigate that. But if you're just answering the ad, there's a very good chance all they're trying to do is get you to call in. They'll sell you something else, or they'll give you some other benefit. They'll up your dental. They'll do something else, but they're going to change your plan. And if you spent any amount of time during the last annual enrollment period, or when you first enrolled, going through your medications, going through your doctors, verifying they're in your networks, getting to know your broker, and choosing the best plan for you at the time, chances are you don't need to switch. And had that benefit been available, your broker would have told you that at the time. So, can Medicare pay for my groceries? Medicare won't pay for your groceries. Can some Advantage plans help me with groceries? Some can, if you're in the small group of people who qualify for it, and the small group of plans that offer it. Does everybody get bombarded with ads and phone calls about it? Absolutely. If you want to call and talk to them, just be careful, because it doesn't take much, and you'll end up in a plan you don't know anything else about, and it won't have free groceries. Word to the wise, there's no free lunch, there's no free groceries. All right, let's move on to another question. A lot of people will enter an Advantage plan. Maybe they think, oh, that doesn't cost anything, and I get health care, and I'm not very sick. That sounds great. Well, as long as you don't ever get sick, that is great. Who wouldn't want health insurance for free, right? Well, nothing's really free, and if you work with a good, legitimate broker, they're not going to say the word free very often. What they're going to do is say zero premium. And a lot of plans have a zero premium. And that sounds great, because that makes us think that it's very low cost. But premium and cost are not the same thing. So you can get an Advantage plan that has a zero premium, but then all Advantage plans work the same. They're going to have a set copay for all the different services that you use. Say going to a specialist, or getting an MRI, or taking an ambulance ride, or going to the emergency room, having some kind of an outpatient surgery, a day surgery, things like that. Each plan's different, They all cover the same things, but they all can charge different amounts or have different copays. Well, you may have gotten a $0 plan. That sounded great. I got free health insurance. Again, it's not really free because it's going to cost you money as you use it. Well, if you didn't investigate all those health benefits and now you have to pay $400 for an MRI, your free plan, free, went from 0 to $400. If you have to have a follow-up MRI 6 weeks later, now you're at $800. Plus you had to see a specialist one time before, one time after, and that was $50. Now you're at another $100. So you're at almost $1,000 for your $0 plan. The problem is a lot of people get distracted. They get distracted by the extra benefits, the dental, the vision, the hearing, things that you see on TV. Or, if you heard my last question, groceries, meals, things like that, transportation. And these things can be wonderful add-ons, but this is not how you should be selecting your plan. You should be selecting your plan based on your medical needs, your providers that you want to go to and stay with, and your medications. That should be your first consideration all the time. Then those extras are exactly that. They're something extra. I advise people not to buy on the extras. The ads on TV, the phone calls, that's all they're going to focus on. The other stuff is almost secondary, but really, that's backwards. Medical should be the primary thing you're worried about because this is your insurance. All the extras are nice to have. I know people rely on them and they need them, but they're not really the things that insurance is built for. All right. Did you make a mistake by picking an Advantage plan? Absolutely not. I've had a great experience. My parents both had supplements. Both my in-laws had Advantage plans. They worked terrific. I'll do a longer version with a story. But basically, my mother-in-law passed away in one day. It cost us $191,000. Well, I take that back. It didn't cost us $191,000. That's what the bill was. It cost us $250 because she had an Advantage plan with a $250 a day copay. That saved our family a lot of heartache that could have been added on to the death of my mother-in-law. So did you make a mistake? Probably not. You just prioritized premium over cost. Do you get the chance to change it? AEP, it's coming up pretty soon here for 2025, a few more months. Look at it again, use a broker that'll sit down with you, go through it, explain it completely, check your doctors, check your drugs. You can rectify those mistakes. Sometimes you gotta write it out for a few months, but it's very seldom a permanent mistake. So don't think of that, think of it as a learning experience, and just do better next time. We love to help people do that. All right, third question for today, and then I'm gonna wrap it up. This one I'm hearing a lot, and nobody likes the answer. Does Medicare pay for Ozempic or other GLP-1s for weight loss? And the answer is no. Medicare does not pay for weight loss only drugs. Now, if you are diagnosed with diabetes and certain heart conditions, those GLP-1s have been authorized for that and FDA approved for that. So, if you're diagnosed with those and your doctor prescribes one of those medications, Ozempic, Mounjaro, sometimes Zepbound, Trulicity, different things like that. There's a number of them now. Ozempic's the one we've all heard of, but there's a couple of them out there in the market. For those other conditions, they're covered, and they're covered pretty well compared to the retail price. And then if you lose weight while you're on them, because that is one of the things they do, that's even better. And that's what helps us get healthier and live a better life. But if you're just doing it to lose 10, 15 pounds, and there was a time when the doctors could do it for that and you get covered, that is no longer the case. So for diabetes and some heart conditions, they're going to be covered. If weight loss is a result of taking it, that's a bonus. They can't write it just for weight loss. It's not going to be covered. Now you can get it through other alternatives. You'll see things on TV. A couple of big weight loss groups are going to help with it. Still pretty expensive, but it can be doable. But as far as relying on Medicare for weight loss, unfortunately, they're not going to do that this year. Drugs change every year. Always check with your broker. Rerun your drugs. Rerun your health. Unless everything's perfect, then don't. That's the other thing. When you get your annual notice of change letter coming up here. We're in August. We're going to start getting those sooner than later. If your plan's not changing and you're perfectly happy with your plan, don't go searching for $10 extra in groceries. Don't go looking for $10 extra in over-the-counter benefits. Stay where you're at. If it's working, don't fix it. You can always look if there's something really substantial. Maybe you'll want to change. Only change if it's going to benefit you substantially, not just because you get the opportunity to do it. Stay consistent with your health, stay consistent with your finances. Trying to chase a few dollars here or there is only going to put you in a hole, and the more you do it, the bigger the hole. Anyway, my name is Mark Bilgier. I own Bilgier Insurance. I'm in the Dallas-Fort Worth area and several other states. If you'd like help, give us a call, send us an email. We'll be happy to help. If you're in a state that I'm not in, I know somebody in that state, and I'll connect you with them, and they'll take great care of you. So have a great day, have a great weekend, and thank you for joining us.